Hello and welcome. Today, we'll be discussing a complex condition known as post-cardiac injury syndrome, sometimes referred to as Dressler's syndrome when specifically affecting the pleura, the lining of the lungs. While often associated with the heart, it can have significant implications for lung health. Let's delve into what this syndrome entails. Post-cardiac injury syndrome, at its core, is an immune-mediated response that occurs after damage to the heart or its surrounding tissues. Common causes include heart attack, cardiac surgery, percutaneous coronary intervention, pacemaker implantation, or even chest trauma. The immune system, in a sense, misinterprets the damaged tissue and mounts an inflammatory attack, leading to various complications throughout the body, including in the pleura surrounding the lungs. The pathophysiology of post-cardiac injury syndrome is rooted in the body's immune response. When cardiac tissue is injured, it releases substances that the immune system recognizes as foreign or dangerous. This triggers the activation of immune cells, such as lymphocytes and macrophages. These cells migrate to the site of injury and release inflammatory mediators like cytokines. When this inflammatory response extends to the pleura, it causes pleuritis, characterized by inflammation and fluid accumulation in the pleural space. This inflammation can lead to pain, difficulty breathing, and other respiratory complications. Estimating the exact epidemiology of post-cardiac injury syndrome is challenging, as it can be underdiagnosed or misdiagnosed. Its occurrence varies depending on the type of cardiac injury. It's estimated to occur in a small percentage of patients after myocardial infarction, but the risk is notably higher after cardiac surgery, particularly after procedures like pericardiotomy, an incision into the pericardium or the sac surrounding the heart. Factors like age, pre-existing autoimmune conditions, and genetic predispositions may influence an individual's susceptibility. The signs and symptoms of post-cardiac injury syndrome can manifest days to weeks, or even months, after the initial cardiac event. Common symptoms include chest pain, often described as sharp and stabbing, which worsens with breathing or coughing. Shortness of breath, known as dyspnea, is another frequent complaint. Patients may also experience fever, fatigue, and a general feeling of malaise. In cases affecting the pleura, a pleural friction rub, a grating sound heard with a stethoscope, may be present, indicating inflammation of the pleural surfaces. Diagnosis of post-cardiac injury syndrome often involves a combination of clinical evaluation, imaging studies, and laboratory tests. The doctor will assess the patient's medical history, focusing on recent cardiac events. A physical examination will help identify characteristic signs like a pleural friction rub. Imaging studies, such as chest X-rays or CT scans, can reveal pleural effusions, which are fluid accumulations in the pleural space. Blood tests may show elevated inflammatory markers, such as erythrocyte sedimentation rate or C-reactive protein. Ruling out other potential causes of chest pain and respiratory symptoms, such as infection or pulmonary embolism, is crucial in establishing the diagnosis. While post-cardiac injury syndrome doesn't have rigid classifications or types, its presentation can vary based on the dominant affected area. In some cases, the pericardium, the sac surrounding the heart, is primarily affected, leading to pericarditis. In others, the pleura is the main site of inflammation, resulting in pleuritis. Both pericarditis and pleuritis can occur simultaneously, or one can predominate over the other. The specific symptoms and management strategies may vary depending on which structure is predominantly involved. Treatment for post-cardiac injury syndrome primarily aims to reduce inflammation and alleviate symptoms. Nonsteroidal anti-inflammatory drugs, or NSAIDs, are often the first-line treatment. For more severe cases, corticosteroids, such as prednisone, may be prescribed to suppress the immune response. In some instances, medications like colchicine, which has anti-inflammatory properties, may be used. If a significant pleural effusion is present, a procedure called thoracentesis may be performed to drain the fluid from the pleural space, providing symptomatic relief. The management plan will be tailored to the individual patient's needs and the severity of their condition. Unfortunately, there aren't specific preventative measures to completely eliminate the risk of post-cardiac injury syndrome after cardiac events. However, early recognition and prompt treatment of cardiac conditions, along with careful monitoring after cardiac procedures, may help minimize the risk. Some studies have explored the potential role of prophylactic medications, such as colchicine, in preventing the syndrome after cardiac surgery, but further research is needed in this area. The prognosis for post-cardiac injury syndrome is generally favorable, especially with timely diagnosis and appropriate treatment. Most patients experience significant symptom relief and resolution of the condition within weeks to months. However, some individuals may experience recurrent episodes or chronic inflammation, requiring ongoing management. Recent research focuses on identifying biomarkers that can predict the development of the syndrome, and on exploring novel therapeutic approaches, such as targeted immunomodulatory therapies, to improve long-term outcomes. As our understanding of the immune mechanisms involved evolves, we can expect further advancements in the diagnosis and treatment of this complex condition.